Hello, dear students. Welcome to GDC Classes. In today's series, I am going to talk to you regarding the posology part. In this, we have some few easy formulas to be done, and related to them, I have even attached the questions. So rather than MCQ, we will be doing questions today. So what is posology? It is nothing but a Greek word. Do remember this thing that this is a Greek word and not the Latin term, because maximum of the pharma words are from derived from the Latin term, but this posology is one of them, which is not from the Latin term. It is from the Greek word which means posos, which means how much, and logos means science, the science of how much, or we can say the dose calculation part. So let us get start dose calculation based on age. So based on age, we have first the Young's formula in front of you. I hope it is visible. Yes. So first of all, the child dose by Young's formula can be calculated by age of child in years divided by age of child in years plus 12 into adult dose. So this is the formula, which is the Young's formula, and Young formula is from the category of determination of dose based on the age. So whatever be the question asking you, they will be ask you what would be the dose calculation or child dose. So you just have to add the age here and do the further calculation. For example, the calculation states that calculate a dose for a child of 4-year-old. It is a 4-year-old child, cimetidine by Young formula when adult dose of the drug is 100 mg. So you have been told to calculate the dose of cimetidine for this particular young child who is 4-year-old, and the adult dose for this is given as 100 mg. So you can write the given data. Age of child is 4, adult dose is 100. The calculation part will become easy from now onwards because you just have to use this formula. So child dose CD will be equal to 4 is the age of the child divided by 12 plus 4 again into the 100, the adult dose. When you calculate it, you will get it 4 divided by what, 12 plus 4 is 16 into 100. Then you know that the 4 ones are 4 fours are, so 100 divided by 4 will be nothing but 25. So option 25 will be the correct answer. Next is about Dilling's formula. This is again based on the age based calculation to calculate the dose. It tells you child dose is equal to age of children in years divided by 20. Here you do not have to add the age in denominator. In Young's formula, we were adding age in the denominator as well. But here we don't have to add it. You just have to add the age of child in years divided by 20 into the adult dose. Calculated dose for child of 7 years old, cimetidine by Dilling's formula when adult dose is 2 mg. What it is? 2 mg is the adult dose, and you have been told to calculate the dose for the 7-year-old child. So age of child will be 7, adult dose will be 2 mg, then child dose will be simple, keep it out, 7 by 20 into 2. So you will get the decimal in the mg in the decimal form, 0.7 mg. So this was based on the age. First we have talked about Young formula, next we talk about Dilling's formula. Now we have Fright's formula here. What Fright's formula is telling you? Again based on the age. What it is telling, the child dose is equal to age of child in months. So if you have to calculate the dose for the infants, then you have to go for this particular formula. So age of child in months divided by 150 into the adult dose. Let us see how it could be done. Calculate a dose for a child of 9-month old. It is 9-month old child, and adult dose given is 250 mg. Simply keep all the remaining data in the formula. So 9 is the month of child, 150 will be the adult, will not be the adult dose, will be the value which is given into 250. Simply calculate, you will get the correct answer, 15 mg. Next is Cowling's formula. So till now what we have seen, we seen Young formula, we have seen Dilling's formula, we have seen the Fright's formula. Now we are seeing the Cowling's formula. So Cowling formula tells that child dose is equal to age of child plus 1 divided by 24 into the adult dose. Okay, age of child plus 1 divided by 24. Here calculate the dose of 5-year-old child by Cowling's formula, and adult dose given is 100 mg. Simply keep all the thing here. It will be 6 by 24 into 100. Then rest is your calculation. Child dose will be 25 mg. I would want you, rather than looking at the solution format, just go with question first, try to solve it by yourself and try to match whether you are getting the same mg format or not, because this will increase your level of understanding. This will ingrain these formulas in your mind. Okay, so do this way. Now next is about the child dose based on the body weight. So till now what we have seen based on the age. Now based on what body weight, the formulas will differ. First of all, the Clark formula is the one for the body weight. Child dose is equal to weight of child in pounds. If the child weight is given in pounds, then you have to use this formula, that weight of child in pounds divided by 150 into the adult dose. And the next formula, again, it is the Clark formula itself, but here the unit is getting changed. The previous one was talking about the pounds, whenever the weight is given in the pounds, but whenever the weight is given in kilogram, then you will use this particular formula, that weight of child in kg divided by 70 into the adult dose. So don't ever interchange this, okay? There are many students who will do this mistake, that 150 will be interchanged by 70 and 70 will be interchanged by 150, and this will mess up your calculation and hence your answer. So child dose, when I talk about to be calculated in pounds, then it would be 150, and in kg, then it should be in 70 into the adult dose. Now here the calculation part is given. Calculated dose for child of 6-year-old by which formula? Class formula, and whose weight is 25 pounds. Now you can see here the pounds has been given. That means you have to calculate it by pounds and not by the kg wala formula. Okay, so here you have to use the pounds formula. Then calculation, adult dose has been given as 500 mg. Simply put the 25 divide by 150 into 500, calculate the rest, you will get the answer as 83.3 mg. Okay, calculation you have to do it, don't just sit ideally, say do the calculation by yourself. Okay, then is next is Hetzel formula, dose calculation based on the body surface area. Here the body surface area, we use the Hetzel formula. Here you can see child dose is equal to surface area of child in meter square, and surface area of adult is 1.73. So the adult surface area is already given, that is 1.73, and the surface area of the child will be given into the adult dose. Now what they are asking, calculate a dose of a child of 7-year-olds by the Hetzel formula whose surface area is 1.9 meter square. Adult dose is 150 mg. So simply you have to do, age of child is 7 years. Here the age is not required. Still we have to write the given data as it is. Adult dose is 150 mg. Surface area is 1.9. Then the calculation part rest remain the same. That is 1.9 divided by 1.73 into 150. So this is your answer. First of all, don't sit ideally, calculate each and every answer to get whether you are accurately solving it or not. So this was all about our posology calculation. So whenever the question will be asking you identify, like MCQ will be like identify which one of the following statements. Suppose I am giving you one question. Tell me that based on the age, which all formula will be there. Young's formula, Dilling's formula, Cowling's formula, and Hetzel formula. So you should know that Young formula, Dilling's formula, Cowling's formula, all of them are from the age base, but the Hetzel formula is from the surface area. So a straight away question can be asked, like based on which category the formula could be used. Like they can also ask you like which among the options is the dose calculation by the age method or age based dose calculation. And you have option as a Clark method, Hetzel method, Fright's formula, and the last one is none of this. Then you must know that Fright's formula will be the correct answer, right? So this way we have done based on age what we have seen. Based on age we have Young's formula, based on age we have Cowling's formula, based on age we have Dilling's formula, based on age for infant we have Fright's formula. This is all we have seen. Next, about the weight. Based on the weight basis, we only have one formula, that is Clark's formula. Then based on the body surface area, on body surface area further we have the Hetzel formula. Many people will get confused into the this particular aspect whether the Clark formula is for the body surface area, because both of them started with C. So you might get confused in both of them. So always remember weight, the Clark weight is calculated. Okay. So you can associate it with this mnemonic that the Clark weight is calculated, and for Hetzel you can remember it as the cat's surface area, right? So this is how it, just for remembering purpose, giving you this mnemonic that Clark weight is calculated and Hetzel's surface area is calculated. So this is all for you today guys, and I hope you remember this particular formula. and do not sit ideally. Try to solve each question. How many questions we have solved? Right, 4 to 5 questions. Try to solve it by your own and prove your mind that you can also do the calculation accurately. Okay, so thank you so much. We'll meet you in the next lecture.